Good afternoon. And today we have an honor to interview Dr. Laura Torrado. Good afternoon, Laura.
Hi, Maria. How are you?
I usually do introduction of my guests using the bio, reading about the courses they attend. But for you, I'm gonna say from the bottom of my heart, because you were the person who actually shine the new light on the way to practice dentistry. Uh,
Okay.
and yes, besides multiple courses, most honorable dental high education institution you attend and graduated from. So you have a lot of dental knowledge, and I want my audience to know about that. But
Mhm.
then, I guess you gain so much knowledge, and your philosophy maybe change to the, I would call it, futuristic way to integrative medicine and dentistry. And we're going to talk about that during our interview. You start practicing in a very unique, distinct way in conjunction with uh, postural physical therapist and behavioral optometrist. So you're trying to address uh, restorative work or orthodontic work under the different light, much more comprehensive than most of the dentists practicing right now. And Laura has an office, absolutely beautiful office next to the Central Park in Manhattan. And she see a lot of patients who did not find the way to go. Like they didn't find the answers to the problem, so they come to Dr. Torrado to find the cure or to get answers to their questions. And we'll find out what exactly happened. And my first question to you would be, can you please give to my audience, and again, thank you very much for listening. I think, we really appreciate you took the time. So please give us an overview of your background and expertise in the field of dentistry and how you come to that journey, craniofacial development.
Hmm. Well, I've been in practice for 33 years. And when I moved to the States, I went to NYU, did the program there for foreign dentist. And I was in my own path trying to know more because I think an initial dental license is just to get started. And I have practiced in my existing location for about 23 years, but all the comprehensive courses that I've done never really address anything more than just teeth. And I kind of fell into it when I first heard about epigenetics appliances. It's like, what is that? Um, it sounds fancy. It sounds complicated. And I was invited to audit a lecture in New York City about a particular provider that was providing this magic appliance that was going to fix the patient's lives. Is that your dog?
Yes, we have another listener tuning in, and I guess if she's not going to be part of our interview, she cannot stop. And she's producing that snoring sound, and I'm really concerned about recording.
Oh, we have more?
Yes, I know yours, but yours knows how to behave because even during the course, or we would say course, private course we had in your
Uh-huh.
practice with
Oh,
Dr.
that's
Svetlov,
right.
she was part of the
Yeah,
like
he has to know
a
what's going on.
coaching crew.
That's a coaching crew. So I think you were asking how did I fall into this way of practicing differently. So I learned about this appliances that supposedly was going to do magic just with a piece of plastic in between the teeth. And it sounded too good to be true, and it was, but it did started a path that I didn't know it existed through Dr. Belfor and his Homeoblock appliance. And the words that he was using, what is it? Epigenetics. What is that? Oh, we're program for perfection. And I researched more, and I started using his appliance. And one thing led to the other, and I just realized that it's not just the mouth. So the mouth is part of the rest of the body. And I met Michael, who you interviewed. I met Dr. Slagnick that you also interviewed. And finally, things make sense. Have like your jaws are part of the cranium, of the neck, of the entire body. And we started treating patients comprehensively, meaning I do a diagnostic of the head and neck, and Michael does the diagnostic of the body and also of the vision. And we integrate all the systems, and success. We have results. We have happy patients. We have patients who have been suffering from scoliosis or TMJ, TMD, and they got better. They got better in new ways, approaching the treatment in new ways. They have been using a certain appliance for a long time, and it was palliative, but it didn't solve much. I think I just fell into it, and the proof is in the pudding, and the results are there, results that we can measure. And I don't know if I answered your question, but
No, you answered my question, but I want for my audience to know what exactly is epigenetic appliance, Homeoblock, or what it does to addressing craniofacial dystrophy. Like it's kind of, even though I interviewed Dr. Belfor and Michael and Samantha, but from you, from the person who have a lot of practical experience, I want to know how exactly Homeoblock address the issues.
well, we call the Homeoblock an epigenetic appliance because it sends signals to the periodontal ligament, and you produce bone displacement on the upper jaw. But a piece of plastic in between your teeth is not going to do the magic. If you don't observe the body as a comprehensive system, if I don't work with the rest of the body through PT or postural restoration, and if I don't work with the rest of the body from a vision point, from the behavioral optometrist, it's just very limited what I could do. Specifically, why would they call it epigenetic appliances? Because when you swallow, there's a force from the tongue that goes against the palate, and the signal sends signals through the design of the appliance into a little spring, and it sends signals to the periodontal ligament, and that's where the gene development starts, where the message for more symmetry, where the message for optimization start. But we're not just a bunch of teeth isolated from the rest of the body. So the epigenetics will happen if through the body we allow it, and through the vision we allow it, and through breath we allow it. I don't know.
Yeah, that's how our plans go. But tell me, why, like in dental school, we both went to actually the same dental school, and I know our education dictate teeth are isolated entity. They exist somewhere in space of the body, and they, doing what exactly teeth or concept of teeth for you, the person who look at the body in much deeper way. Why do we need teeth besides, eating the,
Well, Dr. Coy says that teeth are not for everybody. So we can live without teeth, but why would I? So teeth give you sensory information in space. Teeth give you function, optimization, swallowing, posture. Why? What was the question exactly?
No, I want your definition of teeth, and exactly you gave me the answer, because I want people to understand. But teeth are not, like decorate your smile. I would call it this way.
Teeth
No.
have sensory information. Teeth are innervated by the fifth nerve. The fifth nerve has 3 branches. There's a lot of information. We lose when we lose a tooth and we put an implant. We don't have the sensory information for the periodontal ligament. They relate to posture. They have an emotional component. They have a social component. They have a functional component. Where is my jaw? Where is my neck? That's all determined by teeth. So
yes, that's magical when you talk about that. Like, for me personally, when I start, I choose that specialty, the dentistry, and people look at that like, how would you do that? Do you really like your job? Do you find it poetic or philosophical? Because I do see it just like you see it. I see a lot of a little bit deeper than just that shape or color.
dentistry is practiced in so many ways like tooth carpentry. And
Yes.
that's how we get our training, right? If you fix a tooth really well and you spend hours about dental materials and in the lab processing the tooth itself, but it's not just that. It is attached to the entire body. It's connected to all meridians. It gives you all this nervous system information that when you lose it, it's just not there. It's a handicap, and it doesn't mean that we cannot compensate, and we all live in compensation, but it's not the same.
Yeah, no, it's very deep, much deeper conversation, much deeper explanation of the dentistry, which I like. But my next question to you: how do you typically assess patients to determine if Homeoblock treatment or epigenetic treatment suitable for them?
We start with metrics. We take a CBCT scan and we upload the data to a software, very fancy software that we have from the Mayo Clinic, is analyzed. And that we take photos and we analyze face posture. We take measurements of orthodontics have been using for a long time. And also we take intake forms to see why they're seeking our treatment, what are the symptoms, and what is the past experience with the symptoms, if they have gotten any treatment for it. Because most of the patients that come to us, they have been treated segmentedly. They have gone to somebody who just looked at teeth, or they have gone to somebody who just looked at the jaw, or they have been in the PT chair because have a neck, and everybody owns their problems. I know this is how I function. I have neck problems, or I have TMJ problems, but rarely integrated we answer why, and they're all connected together. So I would say, how do I determine? Starting with metrics, starting with the evaluation of the photos on the CBCT scan.
I have a question for you. Why this field, I would say so deep and important, and almost everybody complain on the neck or lower back or replacement of the knee, hip. Why this field, what you practice, doesn't have such a light, towards the public? Why it's not so known? What do you see as an obstacles?
Well, like everybody else, we all have our opinions. I think that everybody has their own cookie cutter recipe that works to a certain level, and it makes money, and it goes with the status quo, and it's hard to break from that. And it has taken a lot of time. We worked sometimes Friday and Saturdays, seeing patients integratively. I like it because it has opened a door that I didn't know it existed. But if I have to pinpoint why, I think my experience is like, it's too much work. It's too much work to call different doctors and try to integrate it. And they've been practicing for a certain amount of time, and it makes money, and so limited maybe. Oh, this is what I do, and it has worked, and this is what the Academy of Orthodontics says, and it's hard to break rules.
True.
When they are profitable, when they are backed up by major institutions, even boards, right? It's just like a fine line. Are you practicing dentistry, or are you practicing out of the scope of dentistry? No, I'm practicing dentistry, but it happens to be in a patient's head, which is in a patient's body. So it's okay for me to refer to PT or.
Yes. I would like to talk a little bit more about your collaboration with optometrist and PT. How it happened? What you work together, because it's a totally new scheme of things.
I say once we take the CBCT scan and do the evaluation, we see what kind of cranial pattern they have and how that cranial pattern reflects on the body. And I start working with the cranial pattern, and the PT works, assess how that cranial pattern reflects on the posture, and he starts working with the posture. I don't have the ability to diagnose visually. Like he has the prisms and he does all the diagnostic and see, okay, we need to refer this patient to the behavioral optometrist. But I think it's like a bird's eye view and looking at the patient as a whole and see, can I just give you an appliance, or who else do we need to bring the system into neutrality and being more optimal and feeling better and living better?
Can you talk a little bit more about system being in neutrality? What exactly it means?
Being in neutrality, so we function parallel to the floor by force of gravity, and we do alternating shift, right? So our heart, stomach, and liver are in one axis, and for that we need to compensate with the other side. So neutrality is not being to one side or not being to the other one, but being able to alternate and shift. We have one lung bigger than the other one to accommodate that axis of stomach, heart, and liver. What is neutrality? Ability to shift and ability to have reciprocal alternating forces.
And still stand straight and hold the eyes on the level of the horizon. Isn't
correct.
that right?
Correct. And then your nervous system gets the information that you are in neutrality, that you are the best that you could be. And what's it?
Yeah, I guess it's a very complicated thing to have all things all at once, to breathe and in the same through the nose, and at the same time keep the eyes on the level of the horizon and stand on 2 feet.
Well, it's a very fancy system, and if we had developed how we chew, how we breathe, how we were breathing, the environment, if everything was ideal, it shouldn't, because the body is designed to be perfect. But environmental or genetics or where you grow up determines that you're not in balance, that you're not into neutral. How do we bring it back? And how do we diagnose what are the cranial patterns? I think that's the key. You have to start on the how and why.
Yeah, I think those are very important questions. And my last question to you would be futuristic. What do you envision as a future direction of treatment, like epigenetic treatment with Homeoblock or whatever, especially in context of interdisciplinary approach to care? And what areas of research and development do you think will impact the field in the coming years?
I think probably by collecting data from patients that we're treating, and the proof is in the pudding. So these patients came to us with this condition, and through this treatment, this is how much better they felt. So having proof that it works. I hit a wall all the time with orthodontists, or I try to reach out to their medical doctor and they don't even answer, or the ENT. Like we said before, everybody practice segmentedly in a silo mentality. And this is what I do. It works for me. And anything else is outside of my scope. If we could be friends, if we could be open, if all doctors communicate, I think that is the only future. Maybe the dentist won't be working isolated in the dental office, but it will be part of human of a team, of a human optimization area where there's a point of, which is my dream, by the way. There's a point of entry, and a lot of times the point of entry is the dentist, so the point of entry is the optometry, so the point of entry is the PT. And if we are humble enough to understand that we could help each other instead of being in competition for the greater good of the patient and for the greater good of all different professions, that will work. That will work for everybody, but it sounds kind of on a utopia. It's like,
I really hope with it. I highly believe in the social media, and people have a voice. And I think, us doing step by step, even with that interview, I hope it's going to change the field. So thank you very much, Laura. We always appreciate the vast of knowledge you have, and we're looking forward collaborating together to move this field into reality, but it would be accessible to people.
All
Thank
right.
you.
Thank you. Thank you for listening and for the interest and for spreading the word. Okay.